You arrive on scene to a 22-year-old female who is complaining of difficulty breathing and chest pain.
Okay, I'm now on scene. My PP is on. Is my scene safe?
Yes, scene is safe.
Is this my only patient?
Yes, this is your only patient.
Okay. Hi, my name is Rogelio. I'm an EMT. What is your name?
Narita,
Narita, how old are you?
22.
And what is going on today?
I have chest pain and difficulty breathing.
Okay, I'm going to go ahead and request an LS unit. Going off of my patient's seating position, we do not need to take C-spine precaution. My general impression is we have a 22-year-old female dealing with chest pain and difficulty breathing. She was able to answer my questions and track my movements with her eyes. I'll go ahead and give her an A for level of conscience. If you could choose which one's bothering you more, whether it's the chest pain or difficulty breathing, which one would you choose?
Chest pain.
Okay, is there any apparent life threats?
No life threats.
Okay, I'm gonna go ahead and check off my ABCs. My first one is being airway. She was able to communicate well with me, so I'll give her a clear pass on a patent airway. Could you please sit up straight? I'm gonna go ahead and listen for lung sounds. Could you take in a deep breath? Is there any lung sounds?
Slight wheezing.
Okay, since there's some wheezing going on, I'm gonna provide an NBM mask, a non-rebreather mask, at 15 liters per minute. Now I'm gonna go ahead and check for circulation. I'll go ahead and check her pulse again. What is her pulse at?
Strong and steady at 94.
Okay. Now, is there any major bleeding?
There is no bleeding.
And what are her skin signs?
Skin is warm, pink, and dry.
Okay, so I'm gonna go ahead and mark Nereda a priority patient and prepare for transport. Nereda, may I ask you a couple questions to get some more information?
Yes.
Okay. First off, what were you doing when the pain started?
I was playing with my dog
Okay, does anything help with the pain?
by laying down.
Laying down. Could you describe the pain to me?
Pressure on my chest.
Pressure on your chest. Do you feel the pain anywhere else?
On my left arm and jaw.
Okay. If you could pick a number between 0 and 10 being horrible, what number represents your pain?
6.
6, okay. And how long has this been going on for?
30 minutes.
Okay. So going off of your symptoms, your chest pain, along with it feeling in your arm, jaw, and difficulty breathing with wheezing sounds, do you have any allergies?
No.
Any medication that you're taking?
No.
Has this ever happened before?
No.
And when was the last time you ate?
About 45 minutes ago.
And then what were you doing when the pain started?
I was eating breakfast.
So you were eating breakfast before the pain started and you were playing with your dog?
Yes.
Okay. Now, it seems like my patient's cardiovascular system and pulmonary system are being affected. So I'm going to go ahead and check her vital signs. First, I'm going to put on a blood pressure cuff and take her blood pressure, which is at
114/72.
Okay, I'm going to reassess her pulse.
Pulse is strong and steady at 94.
And then what is her respiratory rate?
Her respiratory rate is strong and steady at 22.
Okay. Now, I suspect of possibly a heart attack. That is my field impression of our patient. And I was able to provide Nereda with a normal breather mask at 15 liters per minute. So since Nereda is a priority patient, I'll go ahead and reassess her every 5 to 10 minutes. And my verbal report to my arriving LS unit is that we have a 22-year-old female named Nereda. She is dealing with difficulty breathing and wheezing sounds, which I provided a non-breather mask at 15 liters per minute for her. She is also dealing with chest pain that radiates to her left arm and jaw. This all started about 45 minutes ago after she had breakfast and she was playing with her dog.